Hi, everyone. Welcome to More Good Days, the official podcast of Haven Headache and Migraine Center. I'm your co-host, Nada Hindiye, founder and chief medical officer of Haven. I've been treating folks with migraine as a headache specialist for over a decade and researching the next generation of cutting-edge treatments. Our podcast is here to help you keep up with the latest research, policy updates, and most importantly, practical advice for managing life with headache and migraine disorders. This podcast is here to provide you with valuable insights and support on your journey to more good days. Before we get started, we strive to make all statements in this podcast clinically accurate, but it's not intended to be medical advice. Please review with your provider, or if you're in California, make an appointment with one of our headache specialists at havenheadache.com.
Nada, it's so great to be in person for this episode.
Yeah, it's awesome.
We've got a special episode for everyone today, celebrating Pride Month, talking about some of the issues that affect us on the LGBTQ spectrum. We've got a great guest today with Joe Coe joining us from the Global Healthy Living Foundation and a podcast host himself with Talking Head Pain. But before we get started, I want to kind of set the stage for why this conversation. Neda, maybe you can tell people why this is a topic. What are the statistics for folks that are on the LGBTQ spectrum in migraine?
Yeah. So according to one study, people who identified as lesbian, gay, or bisexual were 83% more likely to experience migraine than people who did not identify as lesbian, gay, or bisexual.
That's sort of a massive difference. Does that break down in any way by identity?
It does. The 2018 National Health Survey suggested that people in the LGBTQ plus community are more likely to have migraine than their straight counterparts. So we see that 36.8% of bisexual women have migraine compared to 19.7% of straight women. And similarly, in lesbian women, we see almost a quarter, so just under 25% have migraine compared to just under 20% of women in the whole, and this is generally taken from US populations. And we see that almost 23% of bisexual men versus just under 10% of straight men have migraine. Nearly 15% of gay men versus that, again, less than 10% of straight men. So we're seeing a very significant difference. The study didn't cover non-binary people or trans men or women. So that's further research to keep in mind that needs to be done.
Yeah, it's a small population to go try to find. It's sad that it wasn't included. Why do we think this is true? Is there any connection of this between childhood adverse events?
Childhood adverse events can significantly contribute to migraine in the entire population. So not even in this community, but there was a meta-analysis in 2013 that confirmed that people who have experienced traumatic childhood events such as abuse, neglect, household dysfunction, they're more likely to experience headache disorders like migraine.
Wow, that's really interesting. And as we know, people on the LGBT spectrum are very likely to experience those events in childhood from their parents, from their peers.
And they're even more likely to experience migraine based on childhood adverse events as well.
Yeah, it's huge. Well, I'm really pleased to have Joe Coe on the podcast, and we'll transition over to that interview. Joe, so excited to have you on the podcast. It was such a pleasure to be on Talking Head Pain a few months ago, and excited to have you on our inaugural Pride episode. We ask everyone on the podcast, what did you do this week with your good days?
Great question. So I'm in my tattoo era, so I got a new tattoo, and also went to the gym and just lived my life to the fullest and embraced every opportunity to feel good.
That's amazing. Can you tell us a little bit about your journey with migraine?
Yes, so I was diagnosed with migraine when I was around 18, 19. I had migraine prior to that. Didn't really know what it was. Knew I had bad headaches and I would get nauseous. For the first time, my mom either noticed that it was coming on because she herself also has migraine, or I was complaining about something and she told me to go into my room, close my shades, take a cold rag with cold water and put it on my eyes. And I went and did that, and that was my first day in bed with a migraine attack. Around 18, 19, they started to get worse. I remember driving myself to my primary care doctor, and I go into the office, and I felt like I was going to vomit. So I told them, I'm like, I'm really not well. And they got me into a room, gave me a bucket, turned off the lights. The doctor came in, said, I think you have migraine. Let me give you an injection of a triptan. And he did that, and it resolved my symptoms. He said, you have migraine. I'm going to prescribe this to you. You could take it at home. I said, but I'm not giving myself an injection. That scares me. So either he prescribed the oral or nasal spray version of that. I don't remember, but I was on both throughout my 20s. And here I am today. Now I get to talk to folks like you and do this work professionally in a way through the Global Healthy Living Foundation and the Talking Head Pain podcast to help us get accelerated diagnosis, to not feel that they're alone. And, I was pretty lucky that my primary care doctor noticed it and believed me. And I was diagnosed pretty quickly in comparison to a lot of folks.
You were diagnosed really pretty early on, and I think a big part of that is that your mom really recognized what you had, and we know that migraine is so genetic. It generally runs in families. It's so important to have someone who advocates for you and to be able to advocate for yourself. That also leads us to the Global Healthy Living Foundation. What do you all do there? And how is that around migraine, and what do you do?
Question. So, the Global Healthy Living Foundation is a nonprofit organization that was formed in 1999. I've been with the organization for about 12 years. We were formed to help people with chronic disease live healthier, happier lives. We started as a message board for people with arthritis under a program called Creaky Joints. We saw that there was an unmet need in the late 90s for connecting people with each other and resources. As that program grew, we saw that there was opportunities to leverage the collective wisdom and knowledge that we're generating in this chronic disease community and help others with other chronic diseases. So we work in various spaces like inflammatory bowel disease, in neurology like migraine, in obesity and understanding that as a chronic disease, cardiovascular health, meant the intersections of mental health with all of these things, and the ability to do multiple things with our patient communities. For those that are advocacy minded, we have a 50-state network of patient advocates that get trained to do legislative awareness and state and federal policy. We have a cohort of folks that will engage in patient-centered research through our Patient Spot program, which provides PRO data and the ability to do different studies across spectrums in the chronic disease space. And then we have the education and support, which is a lot of the work that I do, and things like Talking Head Pain, a podcast that we developed because we saw that there was an unmet need in the migraine and headache community to amplify and share voices that might not reach out to individuals or organizations because they might not identify as having migraine. They might not feel that it's central to their identity. They might be part of a marginalized group, or they might be someone that is just trying to get by their 9 to 5 and doesn't have the extra effort to become like a full-time migraine advocate. So we really saw the need in the market to develop programs for folks that were not being caught by other programs.
That's really awesome. And I can speak from experience that for our followers here, you should definitely also listen to Talking Head Pain.
Yeah, it's one of my favorite podcasts to listen to. It's so informative. The guests are great, the questions are great. And another question I had for you is, what experiences have you had with getting care as a person on the LGBTQ spectrum?
Really interesting question. I am very privileged and have had a lot of opportunities for access, which might not be the same for many members of my community. And so I'm kind of an outlier. So I could speak from my personal experience, but also the work that I do outside and inside GHLF with our local LGBTQ community here in Rockland County, as well as in activism throughout the state. There's a fear for a lot of folks to go to doctors. There's a fear that you're going to be misgendered or that you might be asked questions that are inappropriate, that the provider might not be affirming, that they might not support the gay and lesbian, bi, and trans community. These are fears that people have, and it's not something that you could just look at a provider and make that assessment. You either need to know by word of mouth or by going through the motion of engaging with them in their office. We hear a lot of challenges happen at the front desk. People, that's the first interaction that you have. The people at the front desk, the reception folks, the office managers, those are the most important player in the health ecosystem that's underrated. We don't talk about them. And they set the tone for the office. So we hear a lot that if they're really positive and they understand, people feel very comfortable in the setting. But if they're not, they feel uncomfortable. And we know that a lot of LGBTQ people forego care because they might not have the resources to pay for treatments. They might be deciding that one aspect of their health, maybe their sexual health, is more important than their neurological health.
Yeah. It's surprising. Even in San Francisco here, I've had issues with a provider who I will not name on this podcast. I started PrEP in 2014 and updated my medication list with this provider. And he was like, I don't know if I can give you Botox anymore. You're on an HIV med. And I'm like, what? It's PrEP. And also, you're in San Francisco. What are you talking about?
That makes no sense.
Absolutely not. Insane that just that simple action led to so much judgment in that appointment. And I can imagine it's so much harder for people who are on the trans spectrum.
You know what's interesting? I have received healthcare in LGBT settings, like LGBT health clinics, and I've received healthcare outside of that. The clinics don't understand neurology. End up teaching folks about migraine, um, and vice versa. The neurologists and the headache specialists don't understand that component of sexual health and identity as well. So it's bridging the gap. And I'm in a position where I have the energy and the ability to communicate with these folks. I remember recently I was in an LGBTQ health setting and they had no idea, they didn't know what the GPAMs were or the CGRP medications. I was explaining what the medication I'm on is, which I understand is that not being like so crazy because they are relatively new and a lot of people haven't received education on it. But like if you don't have knowledge in healthcare and if I didn't do this work professionally, I might feel less confident with the provider in both settings if they didn't understand each other. So I think that there's a challenge and an opportunity to how do we collectively educate this these disciplines around the interconnectedness because we're whole beings that are going to have a whole range of issues and migraine is one of them, but there are other things that play with that.
Yeah, I totally agree. I mean, education, especially at the primary care level, is so important. And I think a lot of people in the migraine field advocate for that because one, there's just not enough headache specialists out there. There needs to be a lot more, but care really needs to start at the primary level. And then, it's our goal is really education for everyone in that manner. And also, sexual health is so important too. And it plays a huge role in your day to day migraine. So I totally agree. It's all interconnected and there's a lot more left to do.
Totally. And speaking of the kind of like interconnectedness of migraine and LGBT issues, the expectations of queer culture are often kind of like in odds with having migraine. How have you sort of navigated being in the queer community and those expectations?
Yeah, I think it depends on where you live and the how you not how you define the queer community, but there's definitely the party circuit scene, and that's real, and that probably isn't super migraine friendly. There are also a lot of LGBT people, particularly my age and older, that are now sober and are like living different lives than they were in their teens and 20s. So I see that changing, and it's just finding the folks that resonate with you and being able to be honest with them. So I think that in certain situations it's a challenge, but in others there's a shared empathy of an invisible struggle that people can understand if you have the relationship to have a real conversation around.
How have you found that sort of chosen family for yourself? And what advice do you have for folks with migraine to find that
Yeah,
chosen family?
I think that you just like with anything, migraine is part of who I am. They have to tolerate people. The people that are going to be friends with me and hang out with me have to tolerate a lot, and migraine is probably not high on the what they have to tolerate spectrum. It's finding the people that see the light in you and see what makes you special and make you feel good. And I found a lot of that recently in my gym community, which I would have never thought ever in a million years that that would have been the place where I would think, like, I'm going to find my cohort. People that have shared interests that, particularly around health, I end up doing seminars on the gym floor all the time about migraine because I am now known as the migraine person. So anyone that goes through that gym that has migraine, if I'm in the gym, one of the trainers or one of the other people that go to the gym will be like, talk to Joe. He knows about migraine. I think he has a podcast about it or something. And you end up finding the people that way.
I love that. And well, exercise is so important for migraine to begin with. So it's great that you found a community there and then that people with migraine or headaches and maybe not even know that they're migraine can come to you and ask those questions and you can kind of point them in the right direction. What's a piece of information or advice you think folks who are LGBTQ should know about migraine?
Yeah, I think this is advice I would give anyone. If you have a headache, talk to your doctor. If you have multiple headaches throughout the week, talk to your doctor. I didn't know that having a regular quote unquote headache counted towards migraine days. Because I thought of a migraine as the attack that you have that you are knocked out for a day or two. And I would get them where I would have them for 2 to 3 days straight, where I would wake up and go to bed with them. And I counted that as migraine. I didn't for a long time count the regular headache that I had almost every day because I did, and I thought that was normal. I thought everyone had a headache every day, or like I didn't think to ask people if they didn't or do. Just it was my reality, and that's not normal. So if you're not optimizing your health, if there's something that's off, like having a headache every day, or having a headache once a week, or having a headache 2 to 3 times a week, talk to your doctor and be proactive because you could share some of the literature around this. Earlier you intervene with migraine, and the more aggressively you treat it, the less likelihood it will chronify and become more of a problem as you get older. So I am proactive, and now I'm able to get on better treatments that weren't accessible to me if I didn't understand that this is actually how migraine is defined.
It's so important. I think that point that every headache day counts towards your migraines is so important. And we all came out of the closet. Talking to your doctor about migraine is not going to be as hard. And if you're not being taken seriously, keep pushing towards a neurologist or a headache specialist if you're not listened to in primary care. because just know that like something like only 28% of primary care doctors really understand migraine.
Yeah, and I would also add, specific to the LGBT community, as I think about this more, there are studies, and I think the Pride study did this, where they looked at trauma and how that impacts migraine prevalence and migraine disease burden. This is my hot take. When you live in a society where it tells you you're less than, when you deal with bigotry and discrimination as a child, when we hear all the negative things about LGBTQ people, and we're seeing more and more, unfortunately, bubbling up in this country, really politicized, that does something to your nervous system that is not positive. And migraine can be a manifestation of that, among other things. So, really making sure that we're dealing with all of the holistic reality of what it means to be an LGBTQ person, even in 2024, a lot of us, like Izac and myself, who live in areas that are pretty progressive, we could be in this bubble, but the bubble could burst very easily. And there's a lot of people that aren't in that bubble. And there's a lot of people that are fighting just to get through the day. It makes me remember, I'm going to pull up something that I shared on my personal Instagram yesterday about pride. Pride is important because someone tonight still believes that they're better off dead than being gay. So that does something to us.
And as we talked about earlier, us on the LGBTQ community side are 83% more likely to be experiencing migraine. And there probably is a linkage between the trauma that we experience and that activation of your genes to be prone to migraine. Would you agree with that, Nada?
I totally agree. There's a huge link with any sort of trauma. Also, migraine is a neurological disease. It affects the whole brain and all parts of the nervous system, including that autonomic nervous system that does get activated with, stress. It kind of controls our fight or flight. So all of that gets activated. So it's so important to be proactive to help prevent your migraines and also have a good support system.
Well, thank you so much, Joe. Where can everybody find you or the Talking Head Pain podcast?
Yeah, so talkingheadpain.org, ghlf.org, and we're on TikTok and all the social media flavors of whatever month it is. Really appreciate the invite and the work that you both are doing to help move the needle forward and make sure that people have access to the treatments that can really change lives. And it's certainly like I wouldn't be able to go to the gym and exercise in the way that I want to exercise if I wasn't on good migraine medications. So it's important that we push for that, because when I tried to do it and I was on some of the older stuff, I was passing out, my blood pressure was too low, it was and you can guess the drug. It was, but we don't know. I didn't know that was why I was so tired, because I was on that for 10 years. So really appreciate the work that you're doing to accelerate diagnosis and also treatment options.
Thank you so much. And we really appreciate the work you're doing too. Love your podcast.
So back to our kind of standard episode content of research and policy updates. What's something that you read in the last 2 weeks that really spoke to you?
There was actually a really interesting meta-analysis, or a large study looking at pooling like different epidemiological studies in migraine, because it's always nice to know, like, okay, so has prevalence, it's the percentage of people with migraine, is that staying the same, is that changing, and what about disability from migraine? And this study actually looked at both of those things. And what they found is kind of what we've seen over the last several decades: is migraine is common. It affects 12% of the US population, and it's certainly more common in women. So it affects nearly 20% of women in the US. And, that's not new. We did know that. But what the study also found is that when people are reporting migraine now, they're reporting a lot more disability than they were in the past. So what do we make of that? It's interesting because we're not, they can't tell you why people are reporting more disability, but it could be that they're just documenting it differently. But it also could be that people are feeling more comfortable sharing their disability, and migraine is becoming less stigmatized than it was in the past. But, it also could be increased stress or, air pollution. Other factors can play a role here too that have nothing to do with them.
Yeah, when was the last time something like this came out?
It's been many years. So there's been, epidemiological studies that come out pretty frequently, but maybe aren't so huge. But this looked at, about a dozen studies over the last several years.
Yeah, I mean, and the stress of life has definitely increased in the last 10 years. On my side, I want to cover today just an interesting piece of policy on the LGBT health side, which is the results from a very large push in San Francisco to get people on doxy-PEP. And if you're not familiar with what doxy-PEP is it's pre-exposure prophylactics for preventing gonorrhea, syphilis, and other STIs other than HIV. That's where PrEP comes in. But you take doxycycline 24 hours before or after a sexual encounter. And a large-scale study in San Francisco, which has been a test site for this usage of doxy-PEP, has reduced in real life 58% of STIs in San Francisco for those who have been taking it. And in San Francisco, we've also reached a point where a lot of folks are using it. So it's actually dropped the city's overall STI rate significantly. So doxy-PEP as a way to protect yourself. We'll see you in 2 weeks and have more good days between now and then.